Hi, greetings to all. I am Dr. Prashanth S, consulting hand and microvascular surgery at Panortho Hospital, as well as director of Panortho Hospital. I'm heading the Department of Hand and Microvascular Surgery at Panortho Hospital. I am in this field of hand surgery for more than 2 decades. So, hand surgery per se deals with various problems. To start with, is the hand injuries quite commonly seen, where there is fractures of the fingers, finger bones, and the wrist bones, as well as forearm bones. Apart from this, there is a tendon injuries which are responsible for movement of our fingers, bending the fingers, straightening the fingers. These are known as tendons. They are those injuries. Plus, the hand is alive because of its blood supply. If there is injury to the blood vessels, that is also we are going to deal with. Nerve injuries. Nerves are going to give sensation to the hand. They are just another sensory organ. Even if the person is blind, he can express through his touch. So that's why regaining the sensation is also very other important. Apart from this injury patterns, another common pattern which we seen is the ligament injuries, sports injuries, especially in sports person while playing tennis and other things. Various wrist ligament injuries can happen. For example, TFCC ligament. TFCC ligament is responsible for movement of these movements quite commonly. Usually these are present since many decades, but with the help of an orthoscope, wrist orthoscopy is a fastly developing thing where with a small keyhole we are going to repair all these structures which usually require an open surgery always associated with stiffness. So very few centers in India will do wrist orthoscopy for these ligament injuries, and ours is one of the pioneer center where we address this problem as well, especially the small bones where the opening will lead to stiffness. With a small scope, with a 1 centimeter incision, it will go inside. In the same way, another common problem which we see is carpal tunnel syndrome, day in and day out. All these repetitive stress injuries, software engineers, computer guys, where they do go on doing the same work will lead to repetitive stress, will lead to carpal tunnel, which is also can be addressed by an orthoscope with a small keyhole surgery. See, I'm just telling about surgery. It doesn't mean all require surgery. Most of the situation can be done without any operation as well with a good physiotherapy. If it persistently the problem give you the problem, then only we should look for surgery. Another thing, very important thing which I'm trying to tell you is regarding a teamwork. Hand surgery is not an individual work, it's a teamwork where we team up with the surgeons. Because, for example, if there is a complete amputation of the finger or an amputation of the hand, where we are going to reattach its blood vessels, its nerves looking under microscope, it's a long hour surgery where we require 1 or 2 more colleagues to assist us. Once the surgery part is over, then we have to do a good physiotherapy over a period of time so that you can achieve your sensation back, your movements back, so that you can go back to your work. So the whole department as a team approach is very important. Physiotherapists also play a very good role, very vital role in treating the hand surgery, which needs to be understood by the patient. A long-term motivation, dedication is required so that they can go back to their normal activities. Another aspect is regarding a birth defects. I have many birth defects. There are more polydactyly means there is extra fingers and loss of 1 fingers, loss of thumb. By birth there is loss of thumb because thumb is such an organ which will give you around 50% of your work will depends upon the thumb. That will lead to that much disability. So recreating is thumb. Birth defects we are also going to deal with. Plus another very dreaded injury which we still is brachial plexus injury where the whole upper arm will become paralyzed completely. That also we are going to reconstruct it. So all this whole team approach and a department approach, dedicated approach is required to achieve a good result. So we have got a very good setup where we can have a very ultra modern operation theatre, and it is backed up with very good physiotherapy in it. So we can give you good care of all these wide spectrum injuries, this thing. You are most welcome to visit our center and take our appointment as well. Best regards. Thank you very much.